Namaskar, Swagatam. We would like to welcome you all on our 477th journey today. Occupational therapy. Occupational therapy is also a unique subject, and that is best supportive therapy also. So we have requested our occupational therapy experts, Dr. Pranjal Joshi, Dr. Parul Joshi, Dr. from Qatar, Doha. So welcome. I welcome all the speaker on the day and an expert in the audience also. First of all, I would like to welcome Professor Vishnu Prasad Sharma ji, Professor V.K. Agnihotri ji, Dr. Dinesh Prasad ji, Parul Joshi ji. Swagatam. Welcome you all. Now, without wasting much time, I would like to request Professor Vishnu Prasad Sharma ji for his initial blessings.
Okay, thank you. Namaskar. Good evening to everybody. Respected Professor V.K. Agnihotri, respected Dr. Pawan Kumar Sharma ji, distinguished guests, eminent speaker, ladies and gentlemen. I, Professor Dr. Vishnu Prasad Sharma, welcome all of you to this evening webinar on occupational therapy for quality life. In this important subject, we have eminent speaker, Dr. Pranjal Joshi from Anand, Mrs. Sosikala Nataranjan Doha, Qatar, Vaidya Parule Joshi from Gandhinagar, Dr. Milan Basavada Porbanda. I welcome all the eminent speaker to this evening webinar on occupational therapy for quality of life. It is the most important subject. So once again, I welcome all the distinguished guests, ladies and gentlemen, and eminent speaker to this evening webinar on occupational therapy for quality of life. Namaskar. Over to Pawanji.
Thank you. Thank you very much, sir, for your blessings, inaugural blessings. Thank you. You are our inspiration. You have guided us, contributed for this webinar right from the beginning. You, Agnihotri sir, you. So welcome, sir. Thank you very much.
Okay, thank you. Thank you.
So now, Agnihotri sir, your initial blessings.
Thank you, Dr. Pawan Sharma ji. Namaskar. Our respect and welcome to all the dignitaries, especially those who are our today's guest speakers, Dr. Pranjal Joshi, Mrs. Shashikala Natarajan, Vaidya Parul Joshi, and again, Dr. Milan Basavada ji, along with our Professor Pawan Kumar Sharma ji, Professor Dinesh Prasad ji, Adaraniya Dr. Jagdish Doma ji, and all the guests, all the respected dignitaries who have joined by now. The subject of today's webinar is occupational therapy and for quality life. We consider this topic in two ways, or rather I should say in two aspects. The one is the occupation itself maybe occurs for somebody, and again, it may be helpful for those who are having a lot of sedentary, job, and then they are forced to go for some momentum to make the circulation okay. So what I feel that occupational therapy, for example, that traffic policemen, washermen, they used to keep on standing for hours together to perform their duty as per the occupation, as per their profession. Resultantly, the varicosity of veins is very common to the person, those who are on standing. Again, the postman who used to take almost 20 kilometers or 15 kilometers circle daily on bicycle and standing and sitting, going door to door to deliver the post, though the load of this distribution of postage is lesser because of the courier services, but otherwise that was a very strenuous job. So policemen, say fire brigade persons, there are certain such occupations where the things are very tedious for the performers. And again, those who have got some sort of shortcomings, and they may yield in the form of the, say, handicap status, or some stump is there, some amputation is there. For them, what may be the ways and means for their rehabilitation to meet out their daily needs, and again to provide them a good, say, day-to-day life in a form of the better quality of life. So these two aspects are there where we have to think, we have to work, and we have to get the knowledge from today's guest speakers, because I am just taking out the meaning of this occupational therapy. Otherwise, they will pour their good knowledge along with their experience. So what I feel that everything, even a newborn child to very senior persons, and because of their senile changes and all that, they also get hampered their life. So from the point of view of 0 age to 100 age or above, one has to be careful, one has to be knowledgeful, and sharing is caring, like that. Such type of status will be there, so that the life, quality of life, whatever the life is best, to be maintained in a say peaceful manner, in a comfortable manner, and life should become the conducive for each and every living being. This is my simple opinion. So with these words, I welcome all the speakers and the dignitaries to please come and grace the occasion and enhance our knowledge with your experience. Thank you so much. Over to Dr. Pawan Sharma ji. Namaskar.
Thank you, sir. Thank you very much. Now I would like to request Dr. Pranjal Joshi. Dr. Pranjal Joshi, Hari Om.
Yes, sir. Hari Om, sir. Good
Swagatam,
evening.
Swagatam.
Thank you so
Welcome,
much.
Madam Natarajan ji. Shashikala Natarajan ji, Swagatam. First time on
Thank you.
platform. Welcome, welcome from Doha, Qatar, Doha. Welcome, madam.
Thank you
Thank
so
you.
much, sir.
Yes, thank you very much, madam. Yes. So now I would like to request Dr. Pranjal Joshi. Welcome. Please unmute yourself, Dr. Pranjal. Yes.
Hello, sir. Good evening.
Good evening. Good evening.
My name is Dr. Pranjal Joshi. I am currently working as an assistant professor at Dalya Physiotherapy College. I have pursued my master's degree.
Your sound is not coming.
Hello.
Your voice should be louder.
Okay. My name is Dr. Pranjal Joshi. I have pursued my master's degree in musculoskeletal and sports, and I am currently working as an assistant professor at Dalya Physiotherapy College. Today we are going to talk about occupational therapy.
Dr. Pranjal, please just increase your volume. Your voice is not audible that much.
Wait a minute, sir. Is it audible now?
It's now much better.
Okay. Today, my topic is benefits of understanding the role of occupational therapy modification in our day-to-day life. As we all know and understand that what is occupational therapy, the occupational therapy assists people in improving their cognitive, physical, social, and motor skills. It means that when a patient is suffering from any condition that enables the patient to do or perform any of the such activities like
combing hair, walking, sitting, standing, cooking, drawing, writing, etc. The occupational therapist is a person who assists and helps and provide cognitive, physical, social, and motor skills to the patient so that the patient can uh, perform his or her activity of daily living. The aim is to strengthen ADL so that people can become more independent and participate in various activities. Occupational therapy programs for people with neurological disorder frequently focus on play skills, learning strategies, and self-care. Play skills and learning strategies means the if a person is working and has a desk job, he or she needs so much support and a working efficiency so that the person can attend his or her job as well as can maintain its own disorder or diseases. Sensory issues can also be managed with the help of occupational therapy strategies. The occupational therapy will start by assessing the individual's current level of ability. सबसे पहले occupational therapy में जैसे कि फिजियोथेरेपी में भी होता है और दूसरी जो मेडिकल ब्रांचेस है उसमें भी होता है। और हिस्ट्री के दौरान हम लोग एक असेसमेंट फॉर्म भरवाते हैं जिसके अंदर हम पेशेंट की जो भी डिजीज या कंडीशन है करंटली या कोई भी डिसऑर्डर से कोई पेशेंट गुजर रहा है तो उसका जो असेसमेंट है उसको पहले प्रॉपर असेस करेंगे और उसके हिसाब से उनकी लेवल ऑफ एबिलिटी चेक करेंगे कि करंट उनकी लेवल ऑफ एबिलिटी क्या है। The evaluation will also identify any barriers that prevent the person from engaging in normal day-to-day activities. इवेल्युएशन से हमको ये भी पता चलेगा कि कौन सी ऐसी चीजें हैं जिसके वजह से जो भी पेशेंट हैं उसको अपनी डे टू डे एक्टिविटीज करने में दिक्कतें हो रही है। Based on this assessment, the therapist develops goals and strategies that will allow the individual to work on key skills. Now we will understand what is the role of physiotherapy in providing help to the or assisting help to the occupational therapist. First, if the patient is suffering from any neurological disorder or any other conditions like TKR or THR surgeries, post TKR, post THR surgeries, or any other surgeries, or even cardio related disorders, the physiotherapy will help a patient to recover from its disease. Let's understand how. Physiotherapists help people affected by injury, illness, or disability through movement and exercise, manual therapy, education, and advice. They will maintain health for people of all ages, helping patients to manage pain and prevent diseases. The profession helps to encourage development and facilitate recovery, enabling people to stay at work while helping them remain independent as long as possible. During this physiotherapy session, if a patient cannot be attaining independency on any of the activity of daily living, the patient will be referred to occupational therapist. Physiotherapy is a science-based profession and takes a whole person approach to health and well-being, which includes the patient's general lifestyle. What does an occupational therapist do? It may recommend when a condition or illness affects your ability to do various day-to-day tasks. So, some of the examples of the conditions may include recovery from an injury or surgery, pain management. In pain management, I would like to give an example of amputation, or we can say phantom limb pain. In phantom limb pain, a patient does not have any of the body part which is absent, like during army struggles, many of the army personnel lose their hand or leg, even so sometimes from shoulder to fingers, whole arm or whole leg is amputated. What happens after amputation is the patient or army personnel or any other guy who has amputated its body part suffers from a pain which is actually not there, like pain in wrist joint. If patient does not have his or her own wrist joint, how do they feel pain? It is because of due to neurological disorder or disrupture of nociceptors, which makes person or patient to feel that there is pain in wrist joint. So this occupational therapist will help in providing such activities or tricks to help the patient improve or recover from pain, like giving a mirror therapy. In mirror therapy, both hands are placed in a box full of mirror. One hand is covered and one hand is open. Patient is asked to perform some of the activities to relieve the pain from right any of the limb which is actually there, and suggest to look at the mirror so that patient will feel that his or her the arm or any other limb which is amputated is working and is performing an activity. Neurological conditions such as multiple sclerosis, cerebral palsy, or recovery from a stroke. Patient suffering from cerebral palsy and stroke needs so many modifications in their lifestyle or living area so that they can perform their own basic activity of daily living. Joint conditions such as osteoarthritis and rheumatoid arthritis. In this, I would like to add scoliosis also. Hand conditions such as carpal tunnel syndrome and trigger finger. Developmental conditions such as autism spectrum disorder, learning disorder, and intellectual disabilities. Psychological conditions such as depression and anxiety, dementia, or Alzheimer's disease. Now let's have a quiz time. Uh, you can all unmute and can you all tell me what are the modifications needed to prevent fall from this picture? Hello.
It can be in the last bit.
Okay, actually I'm finishing this.
Oh. Then, please allow us to think. Please
Okay.
allow us to think. What is your
Okay.
question? What is your question, please?
My question is, what modifications by occupational therapist are needed in this picture or diagram to prevent falls of patients?
Road should be clean.
Yes.
Passage should be well maintained, so a person should not fall down.
Yes.
Garden should be clear.
Yes.
This is just common sense. I don't know what you
But
answer you want.
there are some other things such as lighting should be proper, railings should
Yes,
be given, and
yes.
even in this grass some of the area has to be given tiles so that a patient coming from wheelchair or any of the walker or stick, the patient can maintain. Parallel bars can help a patient to climb the stairs, or if a patient is coming in wheelchair, then there has to be ramp over the main door. As you can see in this, the lighting should be proper. In dark there should be radium planted on the stairs should not be broken or have cracks in it. Ramps should be made. Rails of steel or aluminum should be made. This is the second diagram in which I'm asking that what modifications are to be used in living room to prevent falls.
First of all, wires of television and wires of telephone.
Yes, it should be underground. Then
Books,
books
scattered
should be
material.
proper. Uh,
There should be a proper gallery to move the without any obstacle.
yes, no
I
obstacles
think,
should be there.
yeah. And there also on outside, I was having a point that there must be some shaded area where elderly persons or persons those who are on chair may be shifted when the rain occurs or anything of the sort. Even the means fast sunlight.
Yes,
Some shaded area must be there
yes,
outside side.
some shaded area must be there. This sofa should be nearer this
Yeah.
fire flame area. The TV
Exactly.
should be fixed on the wall
Yeah.
so that
Walls,
it does not come between the any person.
Free movement area must
Yes,
be there.
the carpet should be fixed properly.
And some support, I think some say steel stick or something, though they may be having, but some sort of things, umbrella or stick must be there in the corner so that they
Yes,
can be of great help whenever elderly person needs it for such type of necessity.
yes, same way.
Yeah.
Add curtains, shades to reduce glare, rearrange furniture to eliminate cords, add lightening, move or remove the rug, place phone next to the couch, install the setback thermostat and overhead lightning switch. As you have already said the answers, now moving to the next quiz. What modifications should be used to prevent fall injury in this bathroom? Suffering from any of the condition such as I have already mentioned, neurological disorders and other orthopedic conditions. Sir, you have muted. I cannot hear you.
First of all, in front of commode, there must be some say stool type furniture where the elderly person put their feet. And
Yes,
there must be some say rod or something to hold just to maintain the balance, either
yes,
on wall or some any curtain side or anything, so that sometimes we have to exert the pressure for defecation. So for that purpose also there must be some. I have seen some sort of ropes hanging from the roof,
yes.
from the
In
ceiling side.
patient
Yes.
with spinal surgeries and cerebral palsy or any stroke patient, there are some ropes or we can say T pulley is to
Janjeer or
be
pulley,
adjusted here.
chain or pulley.
Yes,
And the floor must be clear. So floor is much
floor
more,
must be clear.
and it should be completely free from the water, so avoid the slip chances. That
Yes.
is yeah. And
One
I
more
think
thing,
yeah.
one more thing that the surface area of the tiles should be more of a friction. It should be rough so that it prevents fall.
Anti-skid,
Yes.
anti-skid. Yeah. And I think the height of the commode must be according to the user. Sometimes
Yes.
this is very important.
You are absolutely right, sir. The height of the commode should be appropriately adjusted according to a patient or a person's height.
Yeah.
The parallel bar or swing up grab bar should be
Right.
adjacent to
Mm,
the
mm.
commode.
Very correct. Very fascinating. Yeah.
In this moving picture, we can see that the surface of the floor is rough
Yeah,
of
right.
wood plated. Mirror and lighting is proper suitable. Windows
Mm,
is much
mm,
more of a height and proper
mm,
space. Curtain or
mm,
towel is nearer to the bathtub.
mm, mm. As you see, there's the lower floor buses are introduced in Delhi in order simply for the especially say privileged persons. So
Yes,
that type of commode system and the floor system should also be there so that
Should
it's
be
easy
provided.
to use.
Absolutely right, sir. Moving next to the quiz, what modifications or preventions should be needed in stairway?
You see, on one side there is a railing, but on other side there should be a rod from base step to the last step. It should be
Yes,
steel rod or some chain or something, so that on up steering and or coming down, both sides there should be a support to hold
yes,
for every person, even for the kids and children and the elderly person, everybody. And the height of this it should not be 9 inches. It should not more than 9 inches of one step.
it should be according to the patient's requirement.
Right,
Yes, you're right, sir. Next, any other suggestions?
These scattered material must be clear so that first the floor should be easy to make movements of the persons by the
Yes,
person. Yeah.
and there should be proper lighting provided over the frames of the photo so that the light also glares up the stairways, or you
I-
can put a radium strip, so
Right,
that the
right.
stairs are easily visible, and the patient can judge the height of the stairs.
And one very important thing I am seeing at every place outside and in the bathroom or here also, there should be some provision of the potable water, drinking water, and that too
Yes,
for the elderly persons or those who are having a little bit neurological disturbance. There may be sippers type bottles available, so that they may just hold and have to without wasting the water or getting themselves wet. The sipper type system potable water must be there so that
should be
before they call
provided.
anybody, they can manage them by themselves.
Yes, you are
Water is,
absolutely right, sir.
water is really needed to each and every living being.
It is much more needed. The possible stairway solutions are: add additional lightning.
Making us so knowledgeable for making putting such type of quiz. We are spontaneously answering, and this is our pleasure that these things can be made so easy. Thank you so much, Dr. Pranjal.
Most welcome, sir. Add additional lightning. Add an additional handrail, as you have already said. Add a three-way switch, which means the lightning switch should be at here also, and before of the starting of the stairway also, so that patient can easily climb a stair and close the lightning. Make step treads, rearrange furniture, remove clutter which are already present here, the books and shoes which are already seen, uh, makes a person to fall due to these obstacles. Thank you so much.
Excellent. Very nicely explained and interacted. Excellent. Honhar Virvan ke hot chikne paat. These are the Apta Vachan. Apta Sista Vivdaste Tesham Sansay न किंचम. ये मेरे को अभी मैडम जोशी जी ने सुबह याद दिलाया. बहुत अच्छा श्लोक है अपना. Thank you, Pranjal. Thank you very much. So now I would like to request Shashikala Natarajan ji. Welcome, madam. Welcome. Shashikala Natarajan ji is in Hamad Hospital, Qatar, Doha. She is occupational therapy specialist in cardiac rehabilitation. Welcome, madam. Welcome on the platform. Please do join every day. YouTube live is there, so please circulate the stream as maximum as possible. Welcome to the platform. First time. Thank you.
Thank you, sir. Good evening, everyone. First of all, I thank you all for providing me an opportunity to present this therapy importance in this platform. Swaraj Healthcare Center on this platform. So thank you, everybody. So to tell about me, like I am Sashikala, like I'm basically from India, Tamil Nadu, Chennai. I was working in both PD in years. Then I came to Doha here. Here I am having an You can able to hear me now? You can able to hear me?
Yeah, now it's clear, but before it, your voice was just breaking. So there might be some glitches
Yeah.
in the network.
Yeah.
Probably.
So I'm Sashikala, occupational therapist.
Yeah.
Currently, I'm in Doha, Qatar, working in Heart Hospital, Hamad Heart Hospital. So basically, we are concerned with cardiac rehabilitations, especially for the cardiac patients' welfare, lifestyle modifications, and general well-being. And so to start with, I would just share the screen. Yeah. So today I'm just going to explain about the role of occupational therapy in enhancing the quality of life. Our brother, he explained in detail about the role of occupational therapy in environmental modifications and in different scenarios how the occupational therapists play a vital role. But my presentation will be totally different. Like I would like to just explain the role of occupational therapy in normal individuals in our day-to-day living, how we can use an occupational therapy to enhance our well-being. So it makes sense that occupational therapists services will be helpful not only for the patient, even for our normal day-to-day living, we can use our therapy services. So to start with, I don't have any conflict of interest in presenting this topic. The main goal of this presentation is we are going to just discuss what is occupational therapy, the role of occupational therapy intervention in various conditions, and the intervention in ADL training, how to make a balance between the work, rest, and life, the occupational functioning areas, and how to generally nurture the well-being physically, mentally, socially, emotionally in our daily activities. So coming on to this, I don't want to just explain in detail because my the presenter who presented before, he explained in detail about the role of occupational therapy. So now just imagine this, just take a moment to think some of the things, the occupations we daily do in our life. For example, as a child, and healthy child, if it is healthy, it will take care of himself or herself in taking care of the self-care, play, leisure. He can able to go for school, attend the classes, communicate with the family members, communicate with the teachers, and lead a happy life. Similarly, an healthy individual, if he is more healthy functionally and physically, he can able to concentrate on his work, take care of the family, able to prioritize his tasks, do money management, transportation, communication, everything in an effective manner. Now, imagine this. Suddenly, an elderly man, there is an history of fall. He broke his leg or unable to move from his place. He will become bedridden. Similarly, what about a healthy child or an abnormal child like with paraplegic or hemiplegic, or an autistic child unable to communicate with others, unable to interact with the environment, unable to express his feeling, or a sportsman who injured his leg or fractured his knee, unable to move, perform his roles and routine, or a child with more of sensory issues, unable to do his or her self-care, or a woman who is emotionally distressed, not able to concentrate on her work or do the household chores. So what will happen in this scenario? Yes, there will be an imbalance in their work and lifestyle. So So they can't able to perform their daily routines. They will become more dependent, and their role gets affected. This may lead to social isolation, physical activity, and finally, poor quality of life. So occupational therapists will help them to go back to their normal life and make them more independent. So it is a client-centered health profession to promote the health and well-being through daily occupation. So occupation is nothing but the role we perform in our daily life as a father role, mother role, worker's role, friend's role, etc. So the occupational therapy will help them to promote their well-being, to do their daily occupation in an effective manner. So the therapist will help them what they want to do, need to do, or expected to do by modifying their occupation, the environment where they live, as our colleague has said about the environmental modifications in detail. So the occupational therapist will help the individual by modifying their environment, give them the better support for their occupational engagement. So thus, occupational therapists will find solutions to the everyday problem, find strategies to reach the chosen goals, adapt the home or working environment, which we have seen in detail, and help them to reach any difficult task in a different manner so that they will be independent in doing the daily activities. So the ultimate goal will be to maintain a balance in physical, mental, emotional, spiritual, and social well-being, thus giving an empower to people to live their life. So, the branches in Ayurveda, there are a lot of branches in Ayurvedic science. Similarly, even in occupational therapy also, we play a role in different branches like pediatrics, geriatrics, cardiology, rehabilitation, orthopedics, neurology, and also psychiatry. Rehabilitation, we provide rehabilitation for the burn patients, palliative care, or any disabled conditions. Occupational therapists play a vital role. Thus, occupational therapists work with children, adolescent, senior, and also adults. Generally, once we consider a patient for occupational therapy service based on an evidence-based approaches, we evaluate the patients with different functional assessments like physically, socially, psychologically, cognitively. All the standardized assessments we used for the patients to focus the patient's occupational performance and individual goals. Once the goals are set for the patients, we use different therapeutic interventions through functional skills training activities to improve their daily livings, sensory motor, communication, cognitive, roles and values, and the vocational skills. Thereby, the patients become independent in their daily life. So, the role of occupational therapists in pediatrics, I don't want to explain in detail. So, you know very well, the therapist will focus the children in physical, motor, social, and behavioral skill through fun-based activities, and so that the children will not think that they are doing some exercises, they are doing some therapy. They think they use play as an therapy role, therapy modem, and help the patients to achieve their functional level. Some of the conditions which we cover, we know the developmental milestones, ADHD, autism, learning disability, and also for the patients, for the normal children who have issues in their communication skills, behavioral skills, etc., we focus them in all aspects. Similarly, the activities of daily living, that is the basic ADL and IADL training, will be given to the patients through therapeutic interventions and also through task skills training. And environmental modifications, you have heard much in detail, like we provide various environmental modifications for the children and also for the adults to make them more functional. Similarly, to improve the muscle strength, the range of motion, instead of giving them the opportunity to do the exercise, we convert everything into a therapeutic activities. So the is or her individual will not feel that they are doing some therapy. They will enjoy these therapeutic activities, and side by side there will be the independence gets promoted. And for the patients who are disabled, who are not able to perform the functional activities, we use lot of assistive and adaptive devices to make them functional in their day-to-day life. Apart from that, for the conditions like persons who have poor frustration tolerance, like energy conservation techniques, joint protection techniques, body mechanics techniques will be taught to the patients, and also proper demonstration also will be given, so that it will be useful for the conditions like low back pain, arthritis, and also for the cardiorespiratory conditions patients. They will have a poor fatigue, poor endurance tolerance in doing some certain activities. Even with light intensity of activities, they feel fatigue. So to overcome those fatigue activities, we do lot of energy conservation techniques, teach them how to use proper body mechanics in carrying an object, or pushing or pulling the activities, like how to make a proper body posture when you're doing your functional activities. Everything will be educated and demonstrated to the patients according to their conditions and their level of performance. And finally, not only the physical skills training will be there, even the psychosocial aspects. We will teach the patients like how the emotional distress affect the overall functional level of the patients, make them understand the importance of the psychosocial well-being of the individuals. And in case if the patient need any activity modifications, we do teach them how to modify an activities, how to simplify the task in an easier manner. So these are all some of the conditions, or some of the roles performed by the occupational therapist in different areas. Now I am just going to focus on how occupational therapy will enhance the well-being of a normal individual. So we all know, like from morning getting up till we go to bed, we play a many role, we play a many tasks, but we are not taking care of ourselves. Only if we are healthy as a healthcare professionals, we can able to take care of the entire society, and also your family, and also our patients. So how we can have an healthy well-being through occupational therapy services. So now we are going to see in detail about the importance of psychosocial well-being, how to make a work-life balance, how to do a time management, how to follow a good sleep hygiene, and intellectual and spiritual well-being, so that there will be a good healthy lifestyle modifications in our daily activities. First and foremost is our activity configurations. We all, for one day, we have 24 hours. In this 24 hours, we have to divide our 24 hours into 8, 8, 8. 8 hours of work, 8 hours of sleep and rest, and 8 hours of leisure and rest. But in case, because of some work, sometimes we do night shift or general shift, we work for more than 12 hours in workplace. Sometimes we will sleep for 4 hours, and we will not concentrate on our active leisures, like going out and playing or doing some sports activities to make her relax. We are not doing so. So this may lead to imbalance. If there is imbalance in our activity, this will affect in the form of physical and psychosocial aspects like obesity, joint pain, tiredness, poor sleep hygiene. All these may lead to unhealthy lifestyle. So usually for the patients, and even for us, we can use this activity wheel to find out whether our activity is balanced. Like from till midnight 12 till 12 afternoon noon, what are all the activities you're doing, whether you're, how many hours you're sleeping, how many hours you're doing your self-care, how many hours you are working. So just find it out and calculate whether there is a balance between work, rest, and leisure. This is roles and value checklist. As we have discussed a lot, occupational therapists will help them in performing the roles and routines in an effective manner. As I said, we all play a different role as a wife, as a mother, as a daughter, as a worker, many roles. Just you can write the roles you perform in the role column and find out whether you have done that in the past, present, and future. For example, if a person has a fracture, he is a worker. Because of the fracture, before he was able to perform the role of a worker, but currently he can't able to perform it because he became disabled. And in future, he likes to do means he will write S. So how much he value that. So this will give a clear picture to the therapist to analyze whether the roles have been performed, whether what is the role conflict the patient face, and how it can be resolved. So this roles and value checklist will give a self-perception to the patient to identify in which areas they are lagging and how to overcome this through conflict resolution. And regarding the sleep hygiene, as I said, sleep is very much important. We all know as a healthcare professionals. So we have lot of toxins in our body. So those toxins can be removed only during the sleep time because the body itself need 8 hours to remove the toxins from the body. If you are not giving proper time for the body to take rest or to get enough sleep, if you sleep for 3 to 4 hours, these toxins gets deposited in different area, and this may cause physical and mental ailments. So proper sleep hygiene is very important for the good quality of life. So these are all some of the things which we can do it for our good sleep hygiene. Follow the regular bed routine. If you go to bed on time, get up on time, and don't watch the clock. Whenever if you're not getting sleep, don't watch the clock. Otherwise it's a biological clock to the brain, like again the same day you will wake up and you will watch the clock. So please don't watch the clock. Clear your mind, be very cool, relax, don't think what we are going to do the next day. Like we will be having the habit of, while we are sleeping only, we will be thinking what we have to do the next morning. We have to get up on time, we have to do this, that. If you are giving work to the brain will not take rest at all and you will not get sleep. So clear a mind, relax, be peaceful, think of some relaxing things which you like most, and get a better sleep. Always follow the sleep ritual. Sleep rituals is nothing but, for some person, they only if they able to listen to a relaxing music, they will get a good sleep. For some individual, they would like to read a book, then they will go for a sleep. Practice some sleep rituals so that whenever you take the book, it automatically the brain will adapt to it and automatically you can go for a sleep. And especially for the naps, for the housewife or for the persons who are at home, usually they'll be having the habit of sleeping in the evening hours. At night they can't able to have a proper sleep. So nap, if you want to take nap, it's well and good, but not more than an hour. If you want to take rest, just take for an hour, then get up. And before after 4 p.m, don't ever go for a nap, otherwise it will affect our sleep at night. And similarly, the environment, the temperature of your room, and the airing, ventilation, and don't watch any horror or electronic movies, like electronic devices. If you just watch it like a mobile or a TV, this will activate our brain cells and we will not able to get proper sleep at all. All this can be adapted to give a proper sleep hygiene. And regarding the psychosocial well-being, this is very much important. Nowadays we are running around like we don't have a proper rest, sleep, adequate rest and sleep in our daily activities. So we are all with more of work stress, health stress and family stress. Even though if it is a positive stress also, stress is stress. So it will have a physical and mental impact on our daily life. So how to overcome the stress? Stress is a non-specific response of the body to any demand. And once if we get stressed, our emotions gets developed, and these emotions are the normal emotions in our daily life, which we show is anger, fear, depression, which comes because of stress. Anger is a normal emotions. We think anger is bad. No, anger is a normal emotion. Everybody will get. It doesn't mean that a person who has a psychosocial issue will emotionally distressed will have anger. No, not at all. Everybody can get anger. But the thing is how we express our anger in an appropriate manner. So make sure you express your emotions in an appropriate manner. So the occupational therapist will help you to express your emotions in an appropriate manner so that you have a healthier relationship with your loved ones. So similarly, whenever you have a stress, identify what makes you stress, what makes you anger. Find out which style of stress level or which anger style you belongs to, and identify your triggering events. For example, triggering event is whenever my mom shouts at me or whenever my mom pinpoints me to do this activity or do that activity, I get more stressed out and become more anxious. So that will be your triggering events. Or whenever my boss is demanding me to do all these activities, I get more triggered. So that will be your triggering events. So find out easily which makes you more stressful and anger. Once we get more emotion, sometimes it will show in our physical reaction. For some person, whenever they get anger, it will show on their face. The face will become red. For some person, they start sweating. For some person, their voice gets stuttered. So it differs from person to person. So find out which physical cues your body is giving so that it gives an alarm to you that you're going to loss of control. You can have a control over it. And finally, deal with your emotions effectively. Now I'm going to teach you some of the strategies which will be helpful for you to identify your anger style, identify your trigger event, know your physical cues, and how to deal with them effectively. As I said about the triggering events, so these are all some of the triggering events. We can call it as an anger or stress pattern. Find out which is your stress pattern so that you can handle your stress carefully. Second thing is your anger style. As I said, anger is a normal emotion. Everyone express it in a different manner. Some person, immediately when they get anger, immediately they will start using physically abusive or vocally abusive. Some patients, some persons will not show their anger. They will keep everything suppressed. They will keep it inside. They doesn't want to show their angerness to others. There are certain category of people will not suppress it or show it openly. They will show it on things like slamming the door or punching the pillow, breaking the things, throwing the phone. So they will show their anger and aggression to the other things. That is called passive aggression. Style D is assertive problem solving. We usually give this questionnaire to the patient to find out which style they belongs to. In case if they score more in any of the area like style A or style B or style C, you are not following an healthy anger style. So we will teach them to go on to a healthy anger style, which is nothing but assertive problem solving. Assertive problem solving is nothing like handle the situation in an assertive manner, standing up for one's right, explain to the other person who makes you anger in a right manner so that they understand that they are troubling you or they hurt you, so that you will have a healthier relationship with others and you will not lose their loved ones. Some of the strategies which we can use whenever you get stressful situation or whenever you are exposed to anger provoking situation. If you find out that there are some physical cues which indicates that you are too much tensed up, you can't able to control your stress, immediate strategies which you can follow is think of a turtle. You know about the turtle. The turtle, once if it exposed to the dangerous situation, it will not handle the situation directly. Instead, it will just withdraw the head inside the shell, just wait for the dangerous situation to go out, and suddenly it will come out once the danger goes away. So I would like you all to follow the strategies of the turtle whenever there is a dangerous, stressful situation or angry situation, don't act immediately. Just relax, take 3 deep breaths, face the situation in an appropriate manner so that your stress and anger can be overcome. Other immediate strategies which you can do is always tell a self instructions to your brain. You know, brain has an capacity to listen your inner dialogue. Always tell, cool off, stay calm, or walk away. In case if you think that I'm going to explode, don't stand there, just move away from the place. Or before reacting to the situation, just count 1, 2, 3 till 10. Or else you can take a deep breath, or you can do a self-talk like, I can handle this, chill, cool, or any positive self-talk will help you to overcome these strategies. Some of the preventive strategies, if you have a time, once you come back home, just sit and think, why did I react like that? Because of this, I started fighting with my friends. My friends will refuse to talk to me, or I had a bad image in front of my friend. All these things will make you think and start doing some preventive strategies. Gives yourself a time to sort things out. Right? Take a paper and write it out. What it happened. Think. Ask yourself what it really happened to you. What was the trigger? Just talk to your friend. Once your anger gets over, just talk in a appropriate tone. Tell them what happened, why you acted like this, so that these are all some of the stressful strategies which will help you to handle the stress in an effective manner. Apart from that, one best thing is, anger, stress, depression, it all belongs to negative energy. So once if you have a negative energy, we have to channelize this negative energy into a positive energy. How we can make it out? It's very simple. Do some exercise, eat some balanced meals, take some adequate sleep, stay connected to people who always reinforce you, who always appreciate you in an appropriate manner. Have friends with the good people who have a good thoughts about you, so that these are all some of the preventive strategies to overcome the stress. As I said about the negative energy, in case if you have a good leisure habits, like some people will have a good active leisure like playing badminton, sports activities, going for gym, or just go for walk. For the housewife, they can do some activities like mopping, sweeping, cleaning the house, so that the negative energy gets channelized into a physical activity, so that the energy level of the negative energy level which is coming out because of anger and stress gets channelized. Very interesting topic is the mindfulness. I hope you all heard about the mindfulness techniques. Nowadays, in all over the world, they have started using this mindfulness technique as one of the meditation one. But let me just explain to you what is this mindfulness, how occupational therapists are using this mindfulness in overcoming the psychosocial aspects of the patients. See, you all know, like once we get stressed, the hippocampus in the brain immediately jumps friend, and it will close our prefrontal cortex of the brain. You know the functions of the prefrontal cortex. The prefrontal cortex in the brain is the main thing which will help us to think and reason out what is good, what is bad. Suddenly, if you have a stress, this hippocampus will jumps up and it will close the function of the prefrontal cortex. Once it gets close the prefrontal cortex, you don't have the time to think and act. So this mindfulness, once you start practicing this mindfulness, this will open up close the hippocampus, and it will stimulate the prefrontal cortex to do the role, so that you can think which one is right, which one is bad, whether to do this. If I do this, how I will be resolving the stress, anger, etc. So just practice this mindfulness in a daily life practice. So mindfulness is a very simple technique. Like whenever you are focusing on a task, observe your thoughts and feeling without judging them. Sometimes whenever we are in a stressful situation, we can't able to focus on a task. So what we will do, our mind will be preoccupied with unwanted thoughts. If the thought comes, let it come. Just observe your thoughts. Take 5 minutes several times a day to close your eyes and breathe. Walk outside, close your eyes and listen to the sounds of nature. Notice what is happening in your mind in the past or the future and gently run to the present. So how occupational therapists do this mindfulness technique in a daily life? For example, if you are going to eat, while we are eating, usually what we are doing, we just focus on our concentration by just watching the TV or watching the phone or talking with friends or thinking about what we do. We become mindless, and suddenly when we see the plate will be empty. So this is called mindless eating. This is not good for our health physically and mentally. But practicing mindfulness, just when you're sitting, don't focus on any task. Just observe how we are eating. Smell the food. Just feel the texture of the food. Just take it inside the mouth and just swallow it. Feel the taste, and so that concentrate on your on your food, so that it helps in good digestion, and also it also promotes a general well-being of the patient. Similarly, when you're going for walking, what we usually think, we will check how many steps we have covered today, how many kilometers we have covered, how was my heart rate when I was walking. When you think about this and walk for a mile, this will make your muscle more tense, and this may cause more stress only. From tomorrow onwards, just go for a mindful walk. Don't think about anything else. Enjoy the greeneries around you. Enjoy the movements of your arms and limbs, and the feeling of air, the nature, the movement of the trees, etc. Enjoy the nature, live in presence and walk. Definitely there will be an improvement in your well-being. Similarly, when you shower, enjoy the shower. Or similarly, when you do a breathing, do a mindful breathing. So start doing all this mindfulness breathing activities, everything in your daily life, till we get up at once, till you go to bed, so that your mindfulness will help you in good lifestyle modifications. And the most important thing is time management. Nowadays we are all like running around the clock. We don't know which task to perform first, which one not to do, which one to postpone, all those activities. Always when you are in your workplace, do time management effectively, so that you have a balance between a work, rest and leisure. Always prioritize the task, make list, divide. If there is a big task, divide the task into multiple steps. Take one task at a time, focus on it in a detailed manner. So once a task gets over, just cross it off and then go on to the next task. Always prioritize the task into 4 matrices, whether it is urgent, not urgent, or whether it can be delegated, or whether to delete or eliminate it. For example, like when you are focusing on an activity today, now you are attending these sessions with me. So now your role is to attend the task. Instead, if you want to watch the mobile or check your email, those tasks can be considered as an not urgent, not important task. So just divide the task into 4 matrix, so that it will be helpful for you for the effective time management. And for the occasional skills, so we all play most of the time we spend only in the work area or in the leisure planning, or even at home. Prolonged sitting is the only thing which we are doing it. If we are standing, we will be continuously standing, or when we are sitting, we'll be continuously sitting. We want work things to be done. We don't bother about the body alignment, and also about the physical strain of the physical strain which we are giving to our body. So work area ergonomics is very much important. So whenever we are focusing on a task, as we have discussed before, clear the clutter, organize the task, so that we can able to focus the task in an effective manner. Don't sit in the chair for a prolonged time. 40 minutes if you're sitting in the same chair, doing some laptop work or attending meetings. 5 minutes, you just get up from the chair, just move around, come back and sit, continue your work, no problem. Or always keep the table in an appropriate height level so that you will not strain your neck or head, your eyes or any other extremities, and maintain a good posture and body mechanics. So in case you walk to work or you stair, is some physical activity is needed. See, park car some longer distance so that you will walk to the work area, so this will become an activity for you. So plan some activity which will give you more ergonomic applications in your daily life, and do some warm-up activities. We all know, since we are all healthcare professionals, we know a lot of exercises and activities. Just rotate your neck, rotate all your joints clockwise and anti-clockwise. That itself is a good warm-up activity for a good blood circulations and for your good energy flow. Similarly, as an occupational therapist, not only for the normal individual, even for the patients, we help them in proper ergonomics, teach them work-oriented therapy, cognitive retraining activities, do a lot of pre-vocational assessments, teach them a lot of work simulation activities and interventions. Then finally, the environmental well-being. So always we should be aware what is happening in and around. Protect our environment and ourselves from hazards. That is important. Nowadays, we are always exposed to AC, and most of our tasks are in our laptop, the computer, electronic device only. So protect our body from the environment and also from the self hazards. Always have a ventilated place, sit in a ventilated place. If you have time, just go out in open air and free yourself, and always make sure that you live in a smoke free place. Example, especially in the car when you are driving or in the work area. If possible, turn down the phone ringing volume and avoid the distractions whenever you are focusing on a task. So this will give a good intellectual enhancement in your daily life. So similarly, the noise-free environment is also very much important. Whenever you are focusing on a task, use furnitures which reduce noise transmissions, and bring the great outdoor inside. Like always plan for some outdoor activities. Take breathe in, breathe out, like simple breathe in, breathe out activities will give you good blood circulations and energy flow to your body. So always have, like, you can arrange your environment or where you sit with different sensory stimulations, like different aromas, smells, that will give an good enhancement physically, socially, and even cognitively to focus on any task. Finally, this intellectual well-being. What is intellectual well-being? Nothing but the cognitive skills. Nowadays, because of a lot of lifestyle changes, we have electronic device in our hand, and in case we don't even remember our loved one's phone number also. Everything, we are not using a memory, attention, concentration. Everything we depends on electronic device. So we are not giving work for our brain at all. So for a right hand dominant person, left brain will be more dominant. For the left, the right, you know very well. So, but what will happen if you give work to both left and right brain to the same time? When they synchronize together and work well, your cognition will be improved. So this can be done through lot of brain gym activities. Brain gym is nothing but we are synchronizing both left and cerebral hemisphere so that you work well. So there are many activities in the brain gym which will make both the hemisphere to work together, so your cognitive skills get enhanced. Otherwise, always do a new learning. It's like new learning in the sense, learn a new language, try to learn a new language, try to learn a new musical instrument, or try to learn a new skill. So when you're learning this, you will be using a lot of problem solving strategies on you, so that your cognitive skills get improved. So whenever you're free, instead of watching movie or doing some passive leisure, do some crossword puzzles, give some work to your brain, give some problem solving strategies like playing chess, Scrabble, do some exercise to your mind and memory. So this will give a cognitive enhancement for your healthy well-being. And do some adventures, like give some work to your intellectual growth and problem solving strategies also. And very important thing we discussed in detail before about the importance of sleep. If you are giving lot of work to the brain, but you're not giving rest to the brain, even that is also a dangerous thing. So give lot of work to the brain to improve your cognitive skill, and at the same time give lot of rest to the brain also by following a proper sleep hygiene for the good cognitive enhancement. Always concentrate on one task at a time. Don't do multitasking, because it is an enemy of full engagement and concentration. Focus intensely on one task at a time, so that you'll be amazed how much more productive and efficient you can be. So from tomorrow onwards, or from now onwards, try to do some cognitive skills on your daily activities, so that you will be able to concentrate on a task in a effective manner. The last thing is, all these can be achieved. Our well-being will be balanced only with the help of our caregivers. We should always care the caregivers, not only for us, even for the patients. You are giving lot of therapy to the patients. You are asking them to follow, but the person who is always there with the patient is the caregivers. They are around the clock. They are the one who is monitoring the patients. So we should always focus them. We should not leave them. Ask them to give reassurance to the patients, and also the therapist should help the family to be realistic in their expectation. They may think that before my son or my husband was doing this and that, now we cannot able to do this, or he should do this. The family members will have lot of expectation. Tell them this is the good thing he can able to achieve, so that the family should not expect the patient to perform the activities beyond this capacity, so they can emphasize what they can do. Thank you.
थैंक यू वेरी मच, थैंक यू वेरी मच शशि जी। बहुत ही आपने इतना मेस्मराइजिंग फ्लो में था, एवरीथिंग वाज इन राइट ऑर्डर एंड फ्लो. यू हैव एक्सप्लेन्ड अस हाउ टू लिव. अग्निहोत्री सर.
Yes, sir. Thank you, sir. Great, Dr. Natarajan. Really, it's beyond our imagination. You not only supposed to be a occupational therapist for the cardiac patients, you proved yourself an occupational therapist for all the living being or human beings. You touched such the emotional factors, especially when a person is going through some occupational therapy. The last slide itself is conveyed a lot, that one should not over expect from the occupational therapist. He or she should be well assessed, no overburden should be given. But at the same time, you touched so deeply, so elaborately. I don't think that this much material can be conveyed to the occupational therapy itself. Really wonderful. I am proud of you that where you are working, all the patients and the families of the patients might be getting the boon and best possible response from yourself. So kind of. Thank you so much.
Thank you so much. Thank you.
Yes,
Please do join. Please share our YouTube link. Please motivate other speakers also on the platform. This is our 477th journey. Because of your cooperation, guidance, so the message is spreading. We are very choosy to invite direct personally because of Zoom bombarding. We have faced 2 times in this journey. Thank you very much, Shashikala ji. Thank you very much.
Thank you so much.
Thank you, ji. Now I would like to request our Madam Vaidya Parulji Joshi. Parul Joshi ji, welcome. She is principal of Bala Hanuman Ayurvedic, Sri Bala Hanuman Ayurvedic College, Lodra. Welcome, madam.
Good evening, everybody.
Welcome, welcome.
A happy World Occupational Therapy Day. After
Welcome.
such a mesmerizing lecture, don't feel like speaking, but I have to go ahead. It is.
You are also ocean of knowledge, madam. Don't say like this. You are ocean of knowledge.
The World Occupational Therapy helps people to function better at work, home, play, life. Occupational therapies help adults, children all over the world. They say it's our job to help clients maintain independence in every area of life. So every area of life, from work as a student, as a housewife, as a caretaker, as a geriatrician, everywhere, at home, at play, every strategy of life. You can see over here, they have given so many pictures. But I wondered when I was preparing these slides that what is the difference and what is actually occupational therapy that they are talking of. Actually, for us, occupation refers to the field or industry, a part of work person is interested in, usual principal work, business, especially as means of earning a living. So that role can be professional, employment, business, etc. This is what we actually know. Then what is the difference between occupational therapy and physical therapy? So they say physical therapy focuses on improving patients' ability to move their body. The word is patient's ability. While occupational therapy focuses on involving patients' ability to perform activities of daily living. Now, activities during birth injuries or birth defects, sensory processing disorders, brain or spinal cord injuries. So this cannot be called activities of a healthy person. Autism and mental behavioral health problems, injuries and disorders, development disorders. But they have said that they help develop fine motor skills that allow them to handle and manipulate items such as pen, utensil, key, or other tool. So the question arises over here is, if a person is healthy, can't he handle a pen, or a housewife handle a utensil, or a person handle the key of the door, or any other tool that he has been using? There are phases in life when people cannot do this. Say in 60+ age group, a person is not able to catch the pen he or she was catching when he was a child. The housewife, when she was newly wedded, she complains in her old age that I'm not able to tackle this utensil. See, I'm feeling it so hard. I can't catch it up. I can't pick it up. So I thought that this occupational therapy must be helping these people in performing these daily jobs, which they have been doing all these years and now are feeling that there is some problem in handling or carrying out these activities. They say improve hand-eye coordination necessary for interacting with the world around them. The hand-eye coordination is a problem in many people, but not in healthy people. Learn basic tasks like eating, bathing, getting dressed, going to the bathroom. These are related with my topic, postmenopausal age group. Regulate and manage emotions, particularly important for children and individuals with behavioral disorder. So it's more of taking care of the person who has certain disabilities. What is the difference between occupational therapy and physiotherapy? Because sometimes I used to wonder that physical therapy and physiotherapy are one. But no, they are also different. Physiotherapy is a healthcare profession directed at evaluating, maintaining, and restoring physical function. That is the definition given by Canadian Physiotherapy Association. So occupational therapists work alongside physiotherapists as a part of the team, and they use physical exercise and modalities to treat physical movement dysfunction. Occupational therapists also use treatment to prevent occupational dysfunction due to physical, mental, or environmental factors. Difference between occupational therapy and nursing, as Madam was talking, we can feel that she was talking more about nursing. So is nursing and occupational therapy the one thing? The occupational therapists are directly involved in performing range of daily tasks like evaluating potential patients, determining their needs, as she was marking. Each time she was saying that determine the needs. For example, the person is getting angry, what are the triggering causes and all that. Designing treatment plan to address those needs, helping patients perform everyday tasks, utilizing rehabilitation methods. While in nursing, we know that there are two types of nurses, registered nurses and nurse practitioners. These nurse practitioners have a liberty to diagnose acute illness and even prescribe medicine. So sometimes I feel that these nurse practitioners are more like doctors. The course material of nursing and occupational therapy courses is more or less the same. Some points are totally common. I have cut it and put it in this so that it just comes inside this slide. So only nursing and only occupational therapy points are very less. Common points are very, very many, and they are major points. So that points have to be noted. Difference between occupational therapist and occupational therapist assistant. They also have an assistant. So, for example, an orthopedic surgeon takes the help of a occupational therapist or a physiotherapist or a physical therapist, and then they take help of another assistant. So when I was reading this and when I was preparing this slide, I was thinking that this should be the cause of making the medical profession very costly. So is it really practical? That question needs to be thought of. So their fundamentals and everything is more or less the same, only the occupational therapist has 1 point more than their assistant, and that is management of their services. They decide what they will give or provide to their client or patient. So sometimes I feel that in India, occupational therapy word has come up in some, we can say during the COVID time, maximum during the COVID time. Oh, why is that happened? You can see that occupational therapists work at hospitals, school, mental health facilities, home care, personal care homes, private clinics, rehabilitation centers. That means they work in every phase of life. They treat from children to teens, adults, seniors, means every age group. Then what is the need of physiotherapist, physical therapist, then doctors, nurses? Why do we need all this? It's all khach-pach bana ke rakh diya hai. Types of occupational therapies. There are 12 main types which Madam has already discussed in detail. Speech therapy, neurorehabilitation, physiotherapy that is assisting the physiotherapist, pediatric therapist, respiratory therapist, counseling psychologist. Then what are these psychologists going to do? Spa therapist, fitness therapist, mental health therapist. What are the psychiatrists going to do? So, and if, for example, I am assisting a gynecologist, the gynecologist asks me to do certain things, but they are against my views. Feel I wholeheartedly follow that person? No, because I am a qualified person, I will tell the patient to follow certain things which the gynecologist has not told me. So that is human nature, and we need to think over that human nature also. But since post-COVID times, we are having so much problem, so many social rehabilitations required, so many disabilities, mental disabilities popping up all around us. We need to think over this, and that's why the scopes of occupational therapists. There are so many courses running, even in our Rajasthan. South also, there are so many courses running, but you can see more courses outside India. There is a journal also there. And this all says that it's a new branch just coming up and giving too many scopes to our youngsters. But one thing everyone needs to understand is occupational therapy is a therapy which helps us do our work properly. And that therapy has to be employed by us judiciously. Because someone said that you control your anger by speaking up to 10, and I'm not able to control my anger by speaking up to 10, I need to go for the second choice. So that is for us to do. Oh, what does Ayurveda do in all this? Ayurvedic occupational therapy. When I was talking to my son, he said that in the MBBS course, they have occupational therapy as a subject, but Ayurvedic course does not have occupational therapy as a subject. Acharya Charak has said, Yanyahasti tadan yatar yanyahasti na tat kvachit tat. We need to prove that Ayurveda also contains occupational therapy. If we will not speak the word occupational therapy, the world is not going to listen to us. So the 4 necessary points for treating a diseased person is Bishak Dravyani Upasthata Rogi Pada Chatushtayam. Bishak, that is the Vaidya, Dravya is the herb or the medicine. Upasthata is the caretaker. Caretaker may be in the form of anybody. Rogi. So if a Vaidya is necessary for treating, but whom he will treat? He will treat a patient. And he will treat a patient who is alive. So, Chetana Dhaturapyeka Smrita Purusha Sanyaka, and that Purusha, Jivatma, should be there in the body we are treating. Why is Bishak given number 1? Because it's important. Physician or surgeon has practical knowledge, has seen many patients with that disease, is confident and qualified to treat that disease, is registered with the council there. He has knowledge of marma, which other pathis don't have. A Vaidya has. A Vaidya has knowledge of emergency situations, and he knows how to tackle them effectively, saving the life of his patient. He knows local herbs and their properties and how to use them. For example, if I want to use Vasa Patra, but the patient is having cough, and because of the cough congestion, he has samavastha, vice versa. Because of samavastha, there is congestion. If I give him vasa patraswaras, he is not able to digest, and that vasa patraswaras will not give me result. So then what do I do? So I first give him hot fermentation, a pyanga with taila, which are having ushna guna, like panchguna taila or karpura taila, or if that is also not possible, sarso. So systemam. That oil massage will stimulate blood circulation there, and then the patient will be given hot water gargles. The patient will just bring out the cough, and after that, if I am giving him vasa patra putpak swaras, so it has putpak has been done, and then the swaras has been extracted, and if I give that, is going to act immediately, and the patient will feel free of cough, will be able to breathe easily. That is the emergency treatment. So if I give him terifylline pump, it will act in 10 minutes, and after 10 minutes, he will again need pump. But in this, since the congestion has been solved, the cough has been removed, there is no blockage, the patient will be able to inhale and exhale smoothly without any support, and that will be a sort of long-lasting effect. So that is how Ayurveda can help, and cost effectively. The Vaidya is able to guide his assistants, nursing staff, laboratory staff, etc., because the list is going to be very long as per the modern standards. And Ayurveda does not mean all this. A Vaidya was doing all this. A village Vaidya, which we are going towards again now, a village Vaidya took care of 4 generations in a family at a time, used to deliver baby, take care of the neonate, and those people from inside mother's uterus till old age and till deathbed did not need any such therapies, because the Vaidya used to take care of them and take care of them personally. He was experienced. The problem today is the Vaidyas do not have exposure, and they probably, it's my imagination that they are trying to refrain from treating emergency cases because they don't have knowledge of the drug they are using. They don't have confidence in the drug. They don't have confidence in their own self, and that needs to be restored so that we can, in India at least, when we are not so sound of economically, we have a huge population to take care of. So we cannot afford all this very costly. So we need to take care of our population in our own way. We have our own ways of handling our problems. So during neonate stage, if we say Navajata Paricharya, childhood, it is Bal Paricharya. During adolescence, in my topic, it is Menarche. So proper Menarche, healthy Menarche, Rajaswala Paricharya, Rutumati Paricharya, Dinacharya, Nishacharya, Rutucharya. Rutucharya is over here, seasonal, do's and don'ts. During pregnancy, Garbhini Paricharya, Punsavan Sanskar, Sagarbha Paricharya ends with labor, onset of labor. So pre-labor, labor, postpartum management, Dhatri Paricharya. During middle age, the lady has to be taken care of so that she does not face problems like having psychological stresses or having genital prolapse or having Sandhikat Vata or Sutika Vyapat. So all that can be avoided if she is taken proper care of during pre-labor, labor, and post-labor, and Dhatri Paricharya. During perimenopause, menopause, and postmenopause, she passes through a very critical phase. But according to Ayurveda, Yati Panchashatah Kshayam. So at 50 and after, the Raja, that is that femininity symbol, menstruation, Kshina Avastha, starts degenerating, does not stop at that time. So that phase, according to modern science, is very critical for her. According to Ayurveda, she passes off from youth to old age. And as our ashrama vyavastha says, from grihastha, she passes on to vanaprastha, and from vanaprastha, she passes on to sannyasa, and it has to be as smooth as I am talking. It should be very smooth, and only then the person has lived like a human being. Otherwise, what modern science has said, that we are Homo sapien under the animal kingdom. So if we are under the animal kingdom and behave like animals, we are going to have multiple problems. And if we see from neonate age to post menopause and after, we see that there are so many hormonal imbalances, but those imbalances don't affect us if we know what to do and how to manage. And for that, we need to educate the masses and see that the masses understand that after one comes two and after two comes three. So if we don't want after coming things, we need to take care of things, as madam said rightly, that we need to take care of our present so that we do not have problems in our future. So mental illnesses like bhutapi shanga, atatvapi nivesh, manavasad, atichintan, bhaya, krodha, or anidra are all affected with Vayu vitiation. So Vata vitiation has to be controlled by Agni. Agni Sandakshan karma has to be done like we take care of the Yagna Agni. So Havishya has to be given. Havishya. Anna has to be Havishya, that which we can put in the fire to keep the Yagna going. So we can't put pizza there, we can't put burger there, we can't put hot dogs there. So what we need to put there is ghritam or sisamam, like that, kukkulu. So that type of food which we can put in our abdomen, which can nourish us. We can't put anything in our abdomen, and everything. If we say panchapautikam, sarvam dravyam panchapautikam, so we can eat anything. No, it's not like that. Eat only that which has been taken by our forefathers, our ancestors, and what our body has been made up of. Our body has been made up of ovum and sperm, and both the families have given inherent properties, panchapautikatva, in those two cells, and mother nurtures those two cells in her body and gives her panchapautikatva also. So rasajaschayam garbha, atmajaschayam garbha, pitrujascha, matrujascha. But what needs to be seen is that whatever is our body constitution has to be known by us when we become adult, and we need to follow that. We need to understand what is beneficial to our body, what is beneficial to our mind, what is beneficial to our emotions, what is beneficial to our behavior. As madam rightly said, that if I quarrel with my co-workers or if I shout at them, they stay away from me. I would give one patient's history and I will end over here. One patient came in the OPD. She touched her body parts, and each time she touched, she started belching. She said, this is the problem I'm facing since 2 years. So I also touched her, but she didn't know I had touched her and she didn't do any belching. So I came to know that this is a psychiatric trouble. So I gave her Vatanuloma Dravyas and said that, for example, I gave her Hingvashtak, and I said that take after meals and with ghee. She said, Desi ghee? I said, yes, Desi ghee. You need to take pure ghee only. She said, okay, then when am I supposed to come? Invariably, you have to come next Wednesday. I had Wednesdays and Saturdays as my OPD days. So come next Wednesday, invariably, I want you here because I want to see the effect of this drug on you. So that impression was that this drug is very particular and is going to help me. So after a week, she came and I talked to her, touching her shoulders. She didn't belch. She sat there quietly. Then I asked her, is your menstruation regular and all that? I started taking extra histories. And one thing that came that if I complain of this, then my husband takes care of me. And if I say that I'm healthy, I don't have any problems, then he doesn't take care of me and he goes away. Where does he go away? He's a businessman, so he goes on his business tours. So if he goes on his business tours, he will bring money. If the money comes, you can wear more ornaments, you can wear rich clothes. Don't you like better saris? She said, yes, I like. Then let him go. So husband was standing there and he said, perfect. You said the perfect sentence. I have been telling her since so many times, but she's not listening to me. You stroke where I'm suffering. So she said, no, I don't need to do all that. No, why should I do it? Then I said, can you do one thing? Can you please come here and get admitted? What for? So I want to give you Abhyang and Swedan, and after Abhyang and Swedan, you will be feeling better. Well, can't you give it on OPD basis? I had to take special permission and we did it. And after 3 days, she felt very nice. She got admitted, took the full course of Abhyang, Swedan, and then we added Pasti to it. After 15 days, she had no complaints because Vatanuloman was done, Vata was in control, and after about 2 years, she came to meet me saying, I'm just enjoying my life, madam. I have no problem. See, I'm able to touch. I'm just pressing my hand. I'm pressing my leg. See, I'm not having any problem. So Vatanuloman and Vata Samshaman needs to be taken care of in our daily lives also. Thank you. Thank you very much. Have a very happy, healthy occupational therapy day. Thank you.
Thank you. Thank you, madam. You are really inspiring as always. Thank you very much. Now, forum is open for discussion as Milan Basawada ji is in not the situation of connectivity. Welcome. Sunita Pandey ji, welcome. After a long time, we are seeing you. Dr. Sunita Pandey ji.
Yes, good evening, sir.
Good evening. Welcome. Welcome ji. Your opinion? आपकी opinion, madam?
Yes, sir. What about, sir? Occupational health?
Occupational therapy event. आज कैसा लगा आपको सुन के? कैसे रहे lectures?
अच्छा रहा सर, बहुत अच्छा लगा. अभी तो पारुल मैम को मैं सुनी रही थी.
जी जी.
It was very informative.
हाँ, आप लोग जुड़ा कीजिए और स्टूडेंट्स को मोटिवेट कीजिए जुड़ने के लिए. सभी चीजें सीखने की हैं.
Yes, sir.
बस नजरिए की बात है. जरूर जुड़ा करें.
नहीं, मैं तो स्टूडेंट्स को सेंड करती हूँ सर. जब भी आपने लिंक भेजा है, मैं भेजती हूँ उनको.
थैंक यू मैडम. सो नाइस.
ओके सर. थैंक यू.
डॉक्टर हेमा मालिनी जी, स्वागतम.
सर.
स्वागतम. स्वागतम. कहाँ है? दर्शन दीजिए.
अभी बाहर है.
अच्छा, शाबाश. शाबाश.
आज ऑक्यूपेशनल थेरेपी डे. मेरी दीदी भी है इस प्लेटफॉर्म में.
हाँ, शशिकला जी ने बहुत ही अच्छा किया.
या शशिकला मैडम मेरी दोस्त है और गोमती आनंदन के नाम में एक पार्टिसिपेंट है. ये मेरी दीदी है. वो भी ऑक्यूपेशनल थेरेपिस्ट.
We would like to listen something from him. Sorry. Gomti ji, welcome.
Yeah,
Gomti
if
Anandan
she
ji, welcome.
prefers, she can come
Sure,
up with her
sure,
ideas.
sure. We would like to welcome.
Thank you, sir.
Gomti ji, namaskar. Gomti Anandan ji, namaskar.
Namaskar ji. Thank you so much
Namaskar,
for
madam.
hosting.
Sorry. We couldn't invite you because we didn't know. Dr.
No
Hema
problem,
Malini
sir.
is our senior commander of AYUSH SAMRIDDHI. So we would like to welcome you
she's
and would
my
like to
sister.
listen you.
And Sasikala, I know her from where she used to study, bachelor's of occupational therapy as well. So well done to you, Shashikala, for putting together all the information. It was very good to listen to your presentation today.
Great to see you. Great to listen you. Great to please highlight some benefits or whatever you want, madam. This platform is yours. Hema Malini is well acquainted with this platform, and it is her platform, your platform. It is not our platform.
Thank you, sir, for the opportunity. But actually, I didn't prepare anything specifically I didn't expect this at all. I say happy Occupational Therapy Day. Being an occupational therapist has made a lot of difference in my life, and as well as I'm able to help out a lot of people around me. I work with elderly care in Republic of Ireland in the health sector there. So I get to meet people in their own home environment, and we do a lot of fall prevention stuff, home modifications, basically ADL activities from the time they wake up to the time they go to bed, what they do and how well they can do it independently. That's what we focus on primarily. We kind of do a bit of a tertiary prevention as well, providing equipments like hoists or wheelchairs, bathroom aids and appliances, bed levers, stuff like that. So that kind of helps people to be independent in their own environment, in their own home, rather than them going to a nursing home to be taken care of. But actually, Shashikala mentioned a lot of different areas that's been covered as well in a lifestyle modification program that we do in a primary prevention way. So that was very good. And I hope everybody will be able to utilize the knowledge and get the benefit out of it. Thank you.
Thank you, madam. Thank you very much. I would like to request Dr. Hema to please communicate Dr. Gomti Anandan's phone number and details so we can invite her in our November's plan well in advance. We would like to welcome her on AYUSH SAMRIDDHI platform. Thank you. Thank you very much, Gomti ji. Thank you very much, Gomti ji, and thank you, Hema ji. Thank you very much.
Thank you, sir.
Now I would like to request Professor Jagdishwar Doma ji. जगदीश्वर जी प्रणाम। आप तो वेबिनार भी चलते चलते अटेंड करते हैं, तो आप तो ऑक्यूपेशनल थेरेपी पे पूरा विश्वास करते हैं, ऐसा मेरा मानना है। जगदीश्वर जी, शायद कोई टेक्निकल प्रॉब्लम है। सर अग्निहोत्री सर, एक बात पूछना थी, अब हम लोग कमांडर से बचे हैं। एक रिक्वेस्ट आ रही है कि इस वेबिनार को रात को 9 बजे से किया जाए। व्हाट इज योर ओपिनियन?
9 बजे से बहुत लेट हो जाएगी। अब विंटर आने वाले हैं, 9 साढ़े 9 तक लोग रजाई में निद्रा देवी की गोद में चले जाते हैं। और आयुर्वेद के अनुसार रात्रि प्रथम भोजनम कुर्यात प्रथम पैणांतरे, तो 6 से 9 के बीच में भोजन करके फिर मैं समझता हूँ प्रैक्टिकली चलेगी तो मुश्किल से आधा एक घंटे चल पाएगी। बहुत ही रेट बिकॉज मॉर्निंग का भी फिर कमिटमेंट्स होते हैं। हम तो चाह रहे थे थोड़ा अर्ली हो जाती, 4 से 6 में फिनिश हो जाए, जैसे पहले चलता था ना 3 बजे 4
नहीं,
बजे।
अभी ये डिमांड आ रही है लोगों की कि साहब 9 बजे से हो तो लोग ज्यादा जुड़े। अब मैं 9:30 10 बजे सोने वाला आदमी,
जी,
मेरे लिए ये अत्याचार होगा, लेकिन फिर भी ये अत्याचार क्या करना चाहिए
आप देखिए ना, आप देखिए 9 अभी बजे हैं और अभी हम लोगों के पास कितने लोग, 8 लोग भी नहीं बचे। बताइए, आज तो हम अभी
तो वो
डॉक्टर हेमा
उन
मालिनी
लोगों का
और
कहना है कि ये वर्किंग टाइम है।
अरे फिर उसके बाद रेस्ट टाइम होता है ना, फिर वो कहेंगे अब तो हमारा रेस्टिंग टाइम है। ये कोई वेबिनार का सब्जेक्ट रेस्टिंग सब्जेक्ट नहीं है, इट्स मतलब बहुत ही ज्वलंत और बहुत ही बर्निंग है, और ये विश्व रिकॉर्ड बना रहा है, तो इसको इतना अंडर एस्टिमेट नहीं करना चाहिए। टाइमिंग जरूर सबके सुटेबल हो, लेकिन इतना भी लेट नहीं। विंटर में तो, नॉर्थ इंडिया में तो विंटर का मतलब होता है 9 बजे तक सारे काम फिनिश करके और शीत से बचा जाए। हम देख पा रहे हैं आज की तारीख में डॉक्टर हेमा मालिनी और अभी मैडम ये जो गोवंती आनंद करके अलावा कुछ नए फेस थे, बिल्कुल नए फेस। आई वाज वेटिंग टू कॉल एंड इनवाइट देम, बट वही है ना कि अब इतनी जल्दी लोग 9 बजे से पहले मैंने प्लेटफॉर्म छोड़ गए। हमारे पास मिस माइकल सरीना, मिस माइकल सरीना जी थी, हमें उम्मीद थी कि वो कुछ बताएंगे, और एक और थे जेनिफर बॉन्डेक। इन लोगों को सुनना था तो हमारी इंटरनेशनल बात बनती। और इस सब के अलावे में हमारे पास थे अपने डॉक्टर पार्शार्थी थंगराज जी। आप लोग कितनी बहुत जल्दी, अभी तो आज हमारे स्पीकर्स के बाद चलेंगे, क्योंकि हमें नए नए स्पीकर्स और नए नए कमेंट्स की ज्यादा जरूरत रहती है। तो अब ये सब लोग इस समय नहीं आए, और
नहीं,
हो
क्या
सकता है।
क्या सर मैं अपने पास एक ऑप्शन है
जी,
अपने पास एक ऑप्शन है। आप यदि आज्ञा दें तो एक वीक इस वेबिनार का समय 8 बजे या 9 बजे करके देखा जाए। देखिए, एक्सपेरिमेंट, वी आर साइंटिस्ट, तो 8 बजे करें कि 9 बजे करें?
7:30 to 9 कर लीजिए, थोड़ा आधा घंटा कम भी कर सकते हैं, 2 से 3 स्पीकर रखें।
नहीं, वो तो बिल्कुल 7:30 पे इन लोगों का कहना है कि जितने प्रैक्टिशनर्स हैं वो
हाँ,
सबके सब 6 से 9 तक बिजी रहते हैं।
बिल्कुल सही बात है। 9 के बाद फिर 9 से 9:30 उनका फिर डिनर टाइम होगा, फिर वो तब आएंगे जाएंगे जुड़ेंगे नहीं। हम बिल्कुल प्रैक्टिकल देखिए, 10 बजे जुड़ेंगे तो वो
क्या हम
नाम
3 दिन करके देख लें?
फॉर्मेलिटी हाँ कर लीजिए, 8 से कर लीजिए, 8 से 10 का
8 बजे कर लेना।
हाँ, लेकिन कोशिश करिए कि टाइम का क्लोजिंग टाइम लिमिट भी होनी चाहिए। इफ इट इज स्टार्टेड एट 8 PM, 9:30 इज द लास्ट।
जगदीश्वर जी, इसमें आपकी ओपिनियन चाहता हूँ। स्वागतम, आपका माइक अनम्यूट है। पारुल जोशी जी की भी ओपिनियन चाहता हूँ। हेमा मालिनी जी भी हमारी कमांडर है। ये समय की बड़ी कंफ्यूजिंग स्टेट आ गई है। जगदीश्वर जी प्रणाम। 7 बजे ठीक है कि 8 बजे ठीक है कि 9 बजे ठीक है? ये बिल्कुल क्या वो आजकल नया आ गया है ना सर, कुछ मल्टीपल
दादाजी अभी तो
MCQ।
मैं नींद कर रहा हूँ, अभी नींद कर रहा हूँ, नींद में उलझ करके हूँ।
स्वागतम स्वागतम स्वागतम।
अगर 8 बजे 9 बजे ऐसा करें तो 11 बजे तक अपन जग करके रहना उचित नहीं है।
ना,
अभी
उचित तो
7
नहीं।
बजे
मैं खुद 9:30 10 बजे सोने वाला।
हाँ, फिर आप तो 9:30 10 बजे तक सो जाएंगे। मैं तो 1 बार ही खाने का रहता है समय। मैं आज सुबह से 1 बूंद दूध भी नहीं लिया, 6:30 बजे खाना खाया।
जी जी जी। पारुल जी, आपकी क्या ओपिनियन है?
सर मेरा भी यही मानना है, जितना लेट रखेंगे उतना सब कुछ अपना अपसेट हो जाएगा। अभी मैडम ने हमें समझाया है कि समय पे नींद लेनी चाहिए, और अभी हम लोग उसका उल्लंघन करेंगे तो कैसा चलेगा। अभी मैडम ने सिखाया हमें।
बिल्कुल, आपने बिल्कुल सही कहा, बहुत सही।
हेमा मालिनी जी,
हाँ जी,
योर ओपिनियन?
मेरी ओपिनियन है कि 6:30 बजे शुरू होने से 8:30 बजे we can finish it off, sir, so that we can have our dinner on time and sleep on time, as we follow the dinacharya. We have to follow the dinacharya. And about the occupational therapy, yeah, occupational therapy also, we see it is mostly correlating with our Ayurvedic science in the Ashtangas of Ayurveda. So it is very fascinating to see that. And Madam and myself was discussing about this. When we see almost all the 8 Angas, Ayurveda with occupational therapy, it was integrating so much. So it is such a good thing to integrate all the sciences with Ayush. So it's really happy to explore many things like this, sir. Thank you so much for giving us all these opportunities. Thank you once again.
This platform is yours, Hema, and please communicate your recommendations for November well in advance in October only, including
Sure,
Madam
sir.
Gomti also.
Sure, sir.
Madam Gomti
She
is fluent.
is a very busy person. Since being occupational therapist, she has joined here today. Definitely, I am circulating all through my social media, sir. Thank you so much. It will be done forever.
Thank you.
Thank you.
Please tag to all ministries, local ministry and central ministries. I would like to request all technical experts in the audience.
Sure.
So please communicate our message, spread our message, and for as communicated in India Star Book of Records has recognized our team work of this 475 webinar, and they are issuing certificates to you all. Congratulations to you all experts.
Thank you.
Means contributing so well. So please communicate your recommendations for November also, well in advance in October only.
सर ये सर्टिफिकेट है ना पवन शर्मा साहब की वजह से आ रहा है, तो उनको पहले हम लोग कॉन्ग्रेचुलेट करेंगे.
ये म्यूट है अग्निहोत्री सर आप.
मैम पालू ने बिल्कुल सही कहा है, सही बात है. हम तो जानते भी नहीं थे किसी को. इन्होंने न केवल इनकी वजह से बल्कि इन्होंने ये जो एक सबको पिरोआ है, एक पूरी बड़ी सी बहुत बड़ी साउथ इंडियन स्टाइल की जो माला बनाई है, जिसमें ये कहते हैं हमारे 6000 5000 कितने इनके गुरु हो गए हैं. हम सबके साथ वही सिचुएशन है. कितनी रोज नई नॉलेज मिलती है आपसे भी और उन सबसे जो गेस्ट स्पीकर्स होते हैं. आज भी कितनी नई नई चीजें बताई गई हैं, कितने नए न्यू ईयर स्टार्स खोले गए हैं. तो सत्य है, इनके ही ये प्रयास है, सब कुछ इनके ही है हाथ में, और इन्होंने ही यहाँ तक इस ऊंचाइयों तक अपने को पहुंचाया है. और जब खुद पहुंचे तो हम सब पहुंच गए. तो वो
सर सच में आप लोगों के आशीर्वाद से ये लगने लगा कि अगला जन्म भी भगवान आयुर्वेद में ही देना. ये नॉलेज जाएगी कहाँ? ये तो बुढ़ापे में आई नॉलेज सर. ये बुढ़ापे के 2.5 साल में नॉलेज आई.
नहीं, आयुर्वेद ही है.
फर्स्ट हो जाऊंगा, इसलिए अगले जन्म में यूज कर पाऊं इस नॉलेज का. ऐसा जन्म भगवान अगले जन्म में यही देना.
आयुर्वेद जीवन हो गया ना, जीवन ही आयुर्वेद निष्ठ हो गया. सब कुछ
3 बजे से रात 10 बजे तक पूरा ही आयुर्वेद
जी.
आयुर्वेद को छोड़ के कुछ नहीं है मेरे.
बहुत बढ़िया, बहुत बढ़िया
जी. अग्निहोत्री सर, योर वैल्यूएबल कमेंट्स, कंक्लूडिंग कमेंट्स.
वेल,
धर्मार्थ काम मोक्ष में मोक्ष कब पाएंगे? रोटेशन करते रहें. मोक्ष
नाम की कोई चीज नहीं है सर मेरे ओपिनियन में.
पाना ही नहीं है.
नहीं, ऊपर वाले ने कोई रेस्ट हाउस या गेस्ट हाउस नहीं खोला सर. ऊपर नाइदर जेल नॉर रेस्ट हाउस. वो बाउंस बैक कर रहा है. इन माय ओपिनियन, नो एनर्जी कैन बी डिस्ट्रॉयड, मींस इट कैन बी ट्रांसफॉर्म्ड, इट कैन बी मॉडिफाइड. तो हम लोग कहीं ना कहीं अपने कर्मों के हिसाब से कोई ना कोई योनि पा जाते हैं. वहीं जेल है. झुग्गी में रहेंगे तो जेल है, और महलों में रहेंगे तो स्वर्ग है. लेकिन ऊपर वाले ने कोई अपने हाथ में गेस्ट हाउस नहीं, तो पब्लिक वहां भी उत्पात मचा देती सर. पब्लिक इतनी शरारती है कि पब्लिक ऊपर भी जाके उत्पात मचा देती. वो भी यूनियन और एसोसिएशन बन जाती. इसीलिए नीचे का टेंशन नीचे पे ही रखा उसने. पुनर्जन्म तो है सर.
लोकसभा विधानसभा में मचा देती है.
मेरे हिसाब से मोक्ष की केवल एक अवधारणा है सर, कि यदि हमारी सोल जो एनर्जी है वो सन में समाहित हो जाए. सन में कंटिन्यूअस एक्सप्लोजन्स हो रहे हैं, वहां एक एनर्जी का स्रोत है. बस उसके अलावा मोक्ष की कोई धारणा मुझे समझ में नहीं आई सर अभी तक. क्षमा चाहता. इस पे
दादाजी ये मत सोचिए कि मोक्ष नहीं है। मुक्ति मोक्ष तो आता ही है, लेकिन वो साधन आपके हाथ में रहेगा, आपके हाथ में रहेगा। लेकिन ये तो कृपा परमात्मा का भी होना पड़ता है।
श्योर
कृपा
श्योर।
परमात्मा की होता है तो इसका मतलब ये नहीं है एनर्जी खत्म हो जाएगा। ऐसा नहीं होता है, एनर्जी कभी खत्म नहीं होता है, न सगुण ब्रह्म होता है न कुछ, क्योंकि वो तो चलते ही रहेगा। लेकिन आप जब गुण रहित हो जाएंगे तब तो गुण रहित में मिल जाएंगे।
तो वो
पहले
गुण
यही
रहित
होता
एक
है
सूर्य ही है सर, और
साधना का
कौन सी चीज है फिजिकली।
साधना का लक्ष्य ही है वो आप गुण रहित हो जाना, साधना का लक्ष्य।
जैसा आप आदेश करें। इस विषय पे भी एक दिन मोक्ष पे भी रखूंगा। हाँ, मोक्ष पे सबके विचार सुनना चाहता हूँ। व्हाट इज मोक्ष? एंड ऐसे भी एक्सपीरियंसेस हैं सर, आप लोगों की नजर में कुछ हो तो प्लीज बताइएगा कि मृत्यु के एक्सपीरियंस क्या है। कई लोग हैं ऐसे जो मरते मरते बचे, मर गए थे, सांस रुक गई 3 घंटा 4 घंटा, और बाद में वो जिंदा लाइव हुए। तो ऐसे लोग यदि आपकी नजरों में हो, प्लीज बताइएगा, हम लोग उनसे सीखना चाहेंगे। अग्निहोत्री सर, गुड नाइट।
गुड
थैंक यू
नाइट
वेरी
सर,
मच।
धन्यवाद सभी का। आज के सभी अतिथि हमारे व्याख्याकर्ता और हमारे आज के जो गेस्ट स्पीकर्स थे, उन्होंने आज बहुत ही नए सब्जेक्ट पे अपने विचार गर्वित जो ज्ञानवर्धन कराया, उसके लिए का बहुत बहुत धन्यवाद। और हमारे सभी प्लेटफॉर्म्स जुड़े हुए प्रोफेसर विष्णु प्रसाद शर्मा जी से लेके और हमारे मैडम मोहिता जी और प्रोफेसर पवन कुमार शर्मा जी, प्रोफेसर दिनेश्वर यादव जी, जब तक हमारे कहानी चलती है तब तक वो चले जाते हैं। ये हम चाहते थे पटना से कुछ उनके विचार आते रहें। और उसके साथ साथ हमारे आज के जो कुछ फॉरेन से स्पीकर जुड़े, कतर से हमारी मैडम जुड़ी, और साथ साथ जो हमारे और क्षत्रिय वाणिज्य जी जुड़े, माइकल जी जुड़े, हेमा मैडम जी जुड़ी, और हमारे बीसी सरकार साहब जुड़े। हमें तो लगा कि इन सबके आज हमें विचार मिलेंगे, बट स्टिल आगे भी जुड़ते रहें और उनको हमारा लिंक मिलता रहेगा। और इसी उत्साह और आशा और विश्वास के साथ में कि हमारी ये जो अनवरत यात्रा है, ये न केवल चल रही है, चलती रहेगी और नए से नए आयामों को छूती हुई नए नए कीर्तिमान स्थापित करती रहेगी। आप सबकी सद्भावनाएं, आप सबका सहयोग हमें आगे बढ़ने के लिए रोज ही अनुप्रेरित करता है। आप सबका बहुत बहुत शुक्रिया, प्रणाम, नमन, और सबका बहुत बहुत धन्यवाद। शुभ रात्रि।
कल बिल्कुल ही नया कंसेप्ट है सर,
जी।
जो अभी आयुर्वेद में बहुत कम है, और कल बिल्कुल ही यूनिक टॉपिक है, एनिमेशन एंड ऑडियो ड्रामा। ये बिल्कुल अलग सब्जेक्ट है। मैं आशा करूंगा कि हम लोग जुड़ेंगे और एक नई चीज सीखने को मिलेगी। सभी लोग ऑडियो ड्रामा वाले हैं या एनिमेशन करने वाले।
वाह वाह,
थैंक यू सर।
थैंक यू, नमस्कार
परसों
नमस्कार।
सोरियसिस, फिर इस महीने की